Hello, welcome back to another video. In today's video, I have 100 questions and answers for you to study for your mammography registry review or registry exam. This is considered like a full mock exam, so it's probably going to be long, but you can always pause the video, come back to the question that you left off at. Also, please like, share, and subscribe for more videos like this. It did take me a long time to make this, so if you could just please like the video, I would greatly appreciate it. And since I do have my license through ARRT or certification, this is the outline that I use. And also, if you are like an international student, because I have international students as well watching my videos, you can still use this, like use the questions to help you study for your test. But for the ARRT registry, there will be 20 questions for patient care, 30 questions for image production. You have 65 questions for procedures, which will give you a total of 115 scored questions. Do not forget about those 30 extra pilot questions that will not be scored. But since you don't know which questions it is, just still do your best on your test. Stay to the end of the video because I do have a playlist where I'm going to let you click on so you can see other videos from me, especially if this is your first time watching my channel. Also, make sure you watch the full video because if you skip around, you may miss some important information. And also, all of these questions are new. I do have like other videos, but these are new questions as well. So try to stay to the end because I really think it's going to help you pass your exam. All right, so first let's get into the disclaimer because I have people asking me this all of the time. So if you can, please read. These practice test questions and answers are made to help you all pass your registry exam. Due to the registry board's copyright law, these questions will not appear on your registry examination in this exact wording, but they are designed and constructed to test your knowledge in order to help you all pass your registry exam. Since it takes time, effort, and research for me to make these questions for you all, I am going to read each question, answer choices, and the correct answer to avoid anyone from reusing my material and voice. If the audio bothers you, please mute the video. Being so that these questions are available to you for free, could you please like, subscribe, and share the video? I would greatly appreciate it. Thank you all for watching and good luck on your registry examination. Please give the video a thumbs up or leave a comment if you would like a part 2 to these 100 questions and answers. These videos will help prepare you for your mammography registry exam. So like I was saying, it did take me a long time to make this video. So I really would appreciate if you all gave the video a thumbs up for me. All right, so quick tips whenever you are watching this video. You have to watch the entire video for this to help you. Read the entire question and the answer choices. If you skip around, you may miss important information. If there is a question or a topic that I have not asked you in this video, it is probably because I already have it in another video that I made. So all of these questions are new. Whenever you are reading through the questions with me or listening, you can always pause the video and write down the question that you stopped on or come back and finish the video in one sitting. And another thing, since this video is going to take a long time, I may have like alarms going off to kind of tell me where I'm at so that I can kind of like keep up with my time. So just in case you see any pauses or breaks in the video, or if like my camera jumps, that's because I had to go back and edit something or I took a break. All right, so I know you all are ready to get into the video, but this is my shout out board. These are all the ladies who passed their registry in September. I encourage you all, if you want to pause and read the video or read the slides, just shout out to all these ladies that passed. This is just, I guess, would be motivation or inspiration to you all to just go through my playlist, watch all of the videos because each video is new and different and it has like important information that can help you pass your test. Also, shout out to these ladies who passed their exam in August. So these are the people from August. Also, shout out to Veronica. She left me a donation after she passed her test. So that was very kind and sweet of Veronica to surprise me one day with a donation. And thank you all for watching the video, liking, coming back, telling me that you passed. And hopefully you share this with everyone that you know so that we can get more people to pass. And then shout out to these ladies who passed their registry in July of 2025. So as you can see, I have a lot of people who've been watching my videos and they've been saying that they have passed. So if this is your first time watching my videos, hopefully that it will help you as well. So after you pass your test, come back to one of my videos and just let me know that you passed. All right, so now we'll get into the good part, the moment that you all have been waiting on, the questions and answers. So if you're new to my video, because I have people who watch my videos all the time, they're not new, but I also have people that are new that watch the videos as well. So what I like to do is I like to read the questions, the answer choices, and then I'll give you time to think about the answer. I just do this because some people have told me that they have listen to my videos while they're at work or while they're on their way to work. So this kind of helps them also listen to it and not have to focus so much on watching it. But there are some parts in the video where you may have to watch it to understand what I'm saying. But and then one last thing, if I sound kind of congested, it's because I am. I had to take an allergy medication to help me get through this video. So that's why I'm saying please like the video. I'm doing this video while I'm sick or feeling under weather because I had people tell me that they are taking their exam like in a few days. So I want to get this video out immediately. So I hope you all enjoy the video. Now we'll get to it. Question 1. How often should the compression force be performed for a quality control QC test for mammography technologists? A, as needed. B, monthly. C, semi-annually. D, weekly. All right, the correct answer is C, semi-annually. The compression force should be performed semi-annually or before clinical use for mammography technologies that are performing the quality control test. Question 2. Which type of breast tissue is shown in this image below? A, almost entirely fatty. B, heterogeneously dense. C, scattered fibroglandular densities. D, extremely dense. All right, the correct answer is B, heterogeneously dense. Question 3. Which of the following is not considered one of the 4 accreditation bodies to accredit mammography facilities under the Food and Drug Administration? A, American College of Radiology, or ACR. B, the state of Arkansas. C, the state of Iowa. D, the state of Louisiana. All right, the correct answer is D, the state of Louisiana. The 4 accreditation bodies to accredit mammography facilities under FDA is the American College of Radiology, or ACR, the state of Arkansas, the state of Iowa, and the state of Texas. Louisiana is not one of those states. Question 4. Which of the following is not considered one of the states that is FDA approved as certifiers to issue A, MQSA certification, A, the state of Florida, B, the state of Illinois, C, the state of South Carolina, D, the state of Texas. All right, the correct answer is A, the state of Florida. The states that are approved as FDA certifiers for a MQSA certification is the state of Texas, the state of Iowa, the state of Illinois, and the state of South Carolina, and also the state of Texas. Question 5. 15 CEUs must be completed every A, 6 months, B, 1 year, C, 2 years, D, 3 years. Right, the correct answer is D, 3 years. 15 CEUs must be completed every 3 years, which is 36 months. All right, so if you are finding this video helpful, could you please like, share, and subscribe for more videos? Like I was saying, I really appreciate you all if you do give the video a thumbs up if you found it to be helpful. And that's because I'm just sitting here, just making a video for you all. I don't get paid to do it. It's just something that I just like to do to help you all pass. So when I see your thumbs ups, when I see your comments and you subscribing to my channel, that's very helpful and it just motivates me to keep making these videos. So thank you all so much. Question 6. Which type of breast tissue is shown in this image below? A, almost entirely fatty, B, heterogeneously dense, C, scattered fibroglandular densities, D, extremely dense. All right, the correct answer is D, extremely dense. Question 7. How many mammogram exams must mammography technologists complete within 2 years? A, 100, B, 200, C, 300, D, 400. All right, the correct answer is B, 200. So the easiest way to do this whenever you do start working as a tech, you can either do 100 a year, or most of the time, if you're full time, you're doing 200 already, probably in the same month. So it's really easy for you to knock out the 200 mammo exams. I think it just get a little bit harder if you are only PRN, but I'm PRN in mammo, and I still get my numbers. I actually get, I think, over 1,000 within a year. So it's pretty easy to get them in. Question 8. Which interaction occurs when an outer shell electron is slowed down by the electric field? A, Bremsstrahlung X-rays, B, classical scattering X-rays, C, Compton scattering, D, pair production. All right, the correct answer is A, Bremsstrahlung X-rays. This occurs whenever an outer shell electron is slowed down due to interacting with a material's atom. Question 9. What is the average grid ratio in mammography? A, 1-to-1 ratio. B, 2-to-1 ratio. C, 3-to-1 ratio. D, 4-to-1 ratio. All right, the correct answer is D, 4-to-1 ratio. The average grid ratio in mammography is 4-to-1, but the ratios can usually vary between 3-to-1 to 5-to-1. Question 10. The grid ratio frequency in mammography is A, 10 to 25 lines per centimeter, B, 20 to 40 lines per centimeter, C, 30 to 50 lines per centimeter, D, 50 to 70 lines per centimeter. All right, the correct answer is C, 30 to 50 lines per centimeter. The grid frequency is the number of lead strips per unit distance that is in an anti-scatter grid. It is usually measured in lines per centimeter. So make sure that you know, if you need to know, it is usually measured in lines per centimeter. Question 11. The purpose of grids in mammography is used to A, decrease contrast, B, decrease discomfort from compression, C, decrease patient radiation dose, D, decrease scattered radiation. All right, the correct answer is D, decrease scattered radiation. The purpose of grids in mammography is to decrease scattered radiation and improve image contrast. Grids increase patient dose, so that's important. Not only do you need to know the answers, know the explanation. And on some slides, if I don't have an explanation, it's because if you don't know this already, I have 3 videos that is 1 hour long where I cover like a lot of this information. So that's just in case you see some slides without explanations. All right, so if you are new to my channel, this is something cool that I just like to do. If you are watching this video, can you put what state you're watching from or what country? It's just something cool that I like to do, especially if someone is thinking about moving to another state. At least they know there are mammo jobs available. So I have people watching from California, Texas, Connecticut, Georgia, Houston, Arizona, Kentucky, Florida, Maryland, and I have a lot of other people commenting. So thank you all for commenting. Florida again, Saudi Arabia. That's the first person comment that I've seen from somewhere else, like another country, Michigan, and we have New Jersey. So shout out to all of you all. Maryland, Arizona, Memphis, Ohio. And then we have more people still watching from Georgia, South Carolina, Chicago, so California. So feel free to leave a comment. This is just something cool that I like to do on my channel. All right, question 12. This is a situational question. A 15-year-old female patient has a breast lump. Which pathology is common for this age in females? A, atypical ductal hyperplasia. B, breast cyst. C, ductal carcinoma in situ. D, fibroadenoma. All right, the correct answer is D, fibroadenoma. Fibroadenomas are most common in younger women that is between age 15 and 35. They are very common in women that is younger than age 30. Breast cysts occur in women most commonly that is between age 30 to 50. Ductal carcinoma in situ is a form of cancer, breast cancer. Atypical ductal hyperplasia is a non-cancerous breast condition that affects the breast ducts. Question 13, another situational question. A 50-year-old woman has a painful breast lump. Which pathology is common for this age group in female patients? A. Atypical ductal hyperplasia. B. Breast cysts. C. Ductal carcinoma in situ. D. Fibroadenoma. All right, the correct answer is B. Breast cysts. Breast cysts occur in women most commonly that is between age 30 to 50. They can be painful and may require aspiration to relieve the pain and make the cyst smaller or go away. Fibroadenomas are most common in younger women that is between age 15 and 35. They are very common in women that is younger than age 30 as well. Ductal carcinoma in situ is a form of breast cancer. Atypical ductal hyperplasia is a non-cancerous breast condition that affects the breast ducts. Question 14. Which border will the most common breast cancer lesions will have? A. Benign. B. Ill-defined. C. Smooth. D. Oval. All right, the correct answer is B, ill-defined. An ill-defined border is what most breast cancers appear as on the mammogram image. Benign, smooth, and oval borders are characteristics of a benign/slash non-cancerous lesion. Question 15. A spiculated lesion is an indication of A, benign tumor, B, malignancy, C, non-cancerous lesion, D, normal mammogram. All right, the correct answer is B, malignancy. Question 16. Which BI-RADS score means incomplete study and requires additional imaging? A, 0, B, 1, C, 2, D, 3. All right, the correct answer is A, 0. So patients must return back for a diagnostic mammogram to complete the exam. At the place that I work at, they normally let a patient go back to screening if it has been like more than 2 years. But if it has been under 2 years, then they require the patient to still get the diagnostic mammogram. Question 17. Which BI-RADS score means probably benign? A, 2, B, 3, C, 4, D, 5. All right, the correct answer is B, 3. BI-RADS score 3 means probably benign. A short-term follow-up is recommended. Question 18. Which BI-RADS score means negative? A, 1, B, 2, C, 3, D, 4. All right, the correct answer is A1. BI-RADS score 1 means negative. This is considered a normal test. Question 19. A minor risk factor for breast cancer is A, alcohol consumption, B, aging, C, dense breast tissue, D, one first degree relative. All right, the correct answer is A, alcohol consumption. Alcohol consumption is a minor risk for breast cancer. Aging, dense breast tissue, and having a one first degree relative is considered a major risk factor for breast cancer. Question 20. A biggest major risk factor for breast cancer is A, early menarche, B, female gender, C, hormone replacement therapy, D, late menarche. All right, the correct answer is B, female gender. The major risk factor for breast cancer is being a female. The minor risk factors for breast cancer is early menarche, hormone replacement therapy, and late menarche. Question 21. True or false? So I'm not saying that your registry exam will have true and false questions. I'm not saying that it will, or I'm not saying that it won't, but this is just a different way to kind of test your knowledge, kind of like get you to think about the question. So this is why I threw this in here. Dense breast tissue is considered a minor risk factor for breast cancer. So is this A, true, or B, false? All right, let's see what the answer is. It is false. So, dense breast tissue is considered a major risk factor for breast cancer. Question 22. Choose one answer. The part outside of an X ray tube is called A, the rotor, B, the stator. All right, the answer is B, the stator. The part outside of the X-ray tube is called the stator. The rotor is located inside of the X-ray tube. Question 23. All of the following are common target materials in mammography except for A, anode, B, molybdenum, C, rhodium, D, tungsten. All right, the correct answer is A, anode. The common target material in mammography is molybdenum, rhodium, and tungsten. The anode is the positive side of the X-ray tube. Question 24. The negative side of an X-ray tube is called the A, anode, B, cathode, C, rotor, D, tungsten. All right, the answer is B, cathode. Question 25. Which material is used for the exit port window in the mammography tube? A, beryllium, B, rotor, C, molybdenum, D, tungsten. All right, the correct answer is A, beryllium. So beryllium or borosilicate glass is the material that is used for the window or exit port of the tube, since the regular glass window could harden the emerging beam. Question 26. The purpose of filtration is to A. Allow for less breast compression. B. Increase low X-ray energies. C. Increase image noise. D. Remove low X-ray energies. All right, the correct answer is D. Remove low X-ray energies. Filtration removes low X-ray energies that does not contribute to the actual image. This helps to improve the image quality and image contrast since noise is minimized. Question 27. Breast augmentation is a surgical procedure that involves A. Breast implants. B. Breast reduction. C. Lumpectomy. D. Mastectomy. All right, the correct answer is A. Breast implants. Breast augmentation involves the surgical placement of breast implants to increase the size or shape of the breast. Breast augmentation was like a very confusing word for me when I first became a mammotech, but eventually I understood that it means breast enhancement. Question 28. The most common focal spot size in mammography for routine work is A. zero point 0.1 millimeter, B. zero point 0.2 millimeter, C. zero point 0.3 millimeter, D. zero point 0.5 millimeter. The correct answer is C. zero point 0.3 millimeter. Question 29. The most common focal spot size in mammography for magnification is A. zero point 0.1 millimeter, B. zero point 0.2 millimeter, C. zero point 0.3 millimeter, D. zero point 0.5 millimeter. All right, the correct answer is A. zero point 0.1 millimeter. Question 30. Which technical exposure factor will lower the radiation dose to the patient? A. Low kV, low mass. B. High kV, high mass. C. High kV, low mass. D. High mass, low kV. And kV and kVp is the same thing. All right, the correct answer is C. High kV, low mass. All right, so if you all are enjoying these videos, could you please let me know in the comment box? Let me know which area of the test that you feel like you would need the most help with. Is it patient care? Is it physics? Or is it anatomy? So just let me know in the comments. Question 31. Which kilovolt range is for a molybdenum target tube? A. 23 to 25 kV. B. 24 to 30 kV. C. 26 to 32 kV. D. 28 to 40 kV. All right, the correct answer is B. 24 to 30 kV. Question 32. Which kilovolt range is for a rhodium target tube? A. 23 to 35 kV. B. 24 to 30 kV. C. 26 to 32 kV. D. 28 to 40 kV. All right, the correct answer is C, 26 to 32 kV. Question 33. Which kilovolt range is for a tungsten target tube? A, 23 to 35 kV. B, 24 to 30 kV. C, 26 to 32 kV. D, 28 to 40 kV. All right, the correct answer is A, 23 to 35 kV. And you can always just go back and just review these questions, especially like the last three or four that I asked you about the target tube and the KVP ranges. You can just keep rewatching it until you understand it. Also, um, put however many that you miss. You can either just let me know in a comment box, hey, I missed this amount, or write down the question that you missed so that you can just keep going back and reviewing it or keep reviewing the video. Question 34. A BI-RADS score indicating a suspicious abnormality will be A2, B3, C4, D5. All right, the correct answer is C4. A BI-RADS score 4 will indicate a suspicious abnormality. A biopsy is recommended. Question 35. A BI-RADS score of 1 will indicate A, incomplete, additional imaging, evaluation, or comparison to prior images are needed. B, negative, normal results. C, benign finding. D, highly suspicious finding. All right, the correct answer is B, negative, normal results. Question 36. A BI-RADS score indicating a known biopsy proven malignancy would be A3, B4, C5, D6. All right, the correct answer is D6. Question 36. The milliampere or MA A controls the penetrating power and the wavelength of the beam. B decreases patient radiation dose when it is set high. C determines the number of X-rays produced. D increases the energy of the X-ray beam. All right, the correct answer is C determines the number of X-rays produced. And sorry, if you see me looking around, it's starting to get like cloudy outside and then the sun comes out, so I'm just trying to see if it's going to rain or not. Question 37. Which breast quadrant are most breast cancers found in? A, lower inner quadrant. B, lower outer quadrant. C, upper inner quadrant. D, upper outer quadrant. All right, I'm sure everyone knows this answer, so I'll just go ahead and give it to you. The correct answer is D, upper outer quadrant. It's still important. Question 38. The kilovoltage or kV, A controls the patient radiation dose, B controls the penetrating power and the wavelength of the beam, C determines the number of X-rays produced, D range is from 20 to 500 for the mammography unit. All right, the correct answer is B controls the penetrating power and the wavelength of the beam. Question 39. How many projections are normally performed for a routine mammogram for both breasts? A, 1, B, 2, C, 3, D, 4. So altogether, if you add up the projections for both breasts whenever you're taking the images, about how many pictures or projections are you doing for a routine mammogram? All right, the correct answer is D4. So these projections are the craniocaudal view, the mediolateral oblique view. So for both breasts, that's a total of 4 for a routine breast. Question 40. The automatic compression should never exceed A, 15 pounds of pressure, B, 25 pounds of pressure, C, 35 pounds of pressure, D, 45 pounds of pressure. All right, the correct answer is D, 45 pounds of pressure. Question 41. A patient with pectus excavatum has A pigeon chest, B, a protruding abdomen, C, a protruding stomach, D, a sunken chest. All right, the correct answer is D, a sunken chest. Question 42. A patient with pectus carinatum has A pigeon chest, B, a protruding abdomen, C, a protruding stomach, D, a sunken chest. All right, the correct answer is A pigeon chest. Question 43. Which projection best demonstrates the medial portion of the breast? A, CC craniocaudal, B, FB from below, C, MLO mediolateral oblique, D, XCCL exaggerated craniocaudal. All right, the correct answer is A, CC craniocaudal. The craniocaudal or CC view demonstrates the medial, anterior, central, and posterior medial portions of the breast the best. Question 44. Which portion of the breast is the craniocaudal CC view poor at visualizing? A, anterior, B, central, C, lateral, D, medial. All right, the correct answer is C, lateral. The CC view is not great at visualizing the lateral aspect of the breast, but it does demonstrate the medial, anterior, central, and posterior medial portions of the breast the best. If you need more coverage on the outside of the lateral aspect of the breast, make sure that you do your XCCL view. Question 45. Which portion of the breast does the medial lateral MLO view demonstrate the best? A, anterior, B, central, C, lateral, D, medial. All right, the correct answer is C, lateral. The MLO view demonstrates the upper outer quadrant and the extreme posterior portion the best. Question 46. Which area of the breast is patient motion mainly visible in on the medial lateral projection? A. Anterior portion of the breast. B. Inframammary fold or your IMF. C. Lateral aspect of the breast. D. Upper outer quadrant. All right, the correct answer is B. Inframammary fold. So whenever you see the images are going, if you look down at the IMF area, you will see kind of like the bottom of that breast tissue where the IMF is at, and the stomach, you may see it moving if the patient isn't holding their breast correctly. So just make sure that you are letting them know what to expect and give them proper breathing instructions. Sometimes patients just cannot hold their breath well. So that may be something where you may have to put in the notes. Images repeated several times, patient unable to follow breathing instruction properly. Still get the best pictures that you can because they will be called back. Question 47. Which medication is recommended to women that may be at high risk for breast cancer? A. Chemotherapy. B. Hormone therapy. C. Raloxifene. D. Tamoxifen. All right, the correct answer is D. Tamoxifen. Question 48. The main side effect of chemotherapy is A. Brittle nails. B. Constipation. C. Diarrhea. D. Nausea and vomiting. All right, the correct answer is D. Nausea and vomiting. Question 49. Which breast cancer treatment causes swelling of the breast? A. Chemotherapy. B. Hormone replacement therapy. C. Radiation therapy. D. Tamoxifen. All right, the correct answer is C. Radiation therapy. So, when you have your patients come in after they have finished their radiation therapy treatment, which probably will be within 6 months to a year, their breast is probably going to look and feel swollen or kind of like swollen and full. That's the word I was thinking about, and full. So you may have to like be very careful whenever you are compressing and keep checking with the patient because their breast tissue may be a little sensitive. You may even see like a different change in color with that breast. Question 50. Which medication is used to treat invasive breast cancer in postmenopausal women? A. Anastrozole. B. Hormone replacement therapy. C. Raloxifene. D. Tamoxifen. All right. And this is question 50, so we're halfway there. I just realized. So, shout out to everyone who have made it this far. Let me know if you watched it all the way up to this point. The answer is C. Raloxifene. All right, so if you made it this far, could you please put a pink ribbon or a pink heart emoji in the comment box section so that I can know that you made it this far? And I'm also gonna put like another thing that you can put so I can know that you made it to another certain point. So if you made it this far and you're seeing this part, put one of these in the comment box. Question 51. Which medication can be used to reduce the chance of breast cancer from reoccurring? A. Anastrozole. B. Fosamax. C. Raloxifene. D. Tamoxifen. All right, the correct answer is A. Anastrozole. And Fosamax, that's normally used for patients who or have osteoporosis. I've seen that used for patients who have problems with their bones whenever I do bone density exams. Question 52. Which breast anatomy does majority of breast cancers occur in? A. Acini. B. Connective tissue. C. Fibrous tissue. D. Terminal duct lobular unit. All right, the correct answer is D. Terminal duct lobular unit. Question 53. Which breast cancer accounts for approximately 90% of all breast cancers? A. Ductal carcinoma in situ. B. Invasive lobular carcinoma. C. Lobular carcinoma in situ. D. Paget's disease. All right, the correct answer is A. Ductal carcinoma in situ. If pathology and breast cancers is something that confuses you, if you do not see, I do have a separate video where I have nothing but breast cancer questions on it and breast pathology. I think I have 2 or 3 parts. So you can also check that out in my playlist if you do not see what you're looking for in this video. Question 54. Which breast cancer is known as stage 0 breast cancer? A. Ductal carcinoma in situ. B. Invasive lobular carcinoma. C. Medullary carcinoma. D. Paget's disease. All right. The correct answer is A. Ductal carcinoma in situ. And it wouldn't be invasive lobular carcinoma because invasive, think of that it's not stage 0 because stage 0 is the initial stage. When something's invasive, it's already gone to other, stages. Question 55. A strong sign of a malignant breast tumor is A. Circumscribed lesion. B. Radiolucent lesion. C. Spiculated borders. D. Smooth borders. All right, the correct answer is C. Spiculated borders. Question 56. Which breast imaging scan would an asymptomatic patient receive? A. Breast ultrasound biopsy. B. Diagnostic mammogram. C. Screening mammogram. D. Stereotactic biopsy. All right, the correct answer is C. Screening mammogram. Asymptomatic means showing no symptoms. So these patients would have a screening mammogram. Patients that are showing symptoms such as a breast lump will have a diagnostic mammogram. Question 57. The American College of Radiology Phantom is performed A. Daily. B. Monthly. C. Semi-annually. D. Weekly. All right, the correct answer is D. Weekly. And the Phantom is performed either weekly or before clinical use. Question 58. The compression thickness indicator is performed A, daily, B, monthly, C, semi-annually, D, weekly. All right, the correct answer is B, monthly. Question 59. Amorphous selenium is A, converts light to electrons, B, converts light to X-rays, C, converts X-ray to electrons, D, converts X-ray to light. All right, the correct answer is C, converts X-ray to electrons. Question 60. Cesium iodine, A, converts light to electrons, B, converts light to X-rays, C, converts X-ray to electrons, D, converts X-ray to light. All right, the correct answer is D, converts X-ray to light. Question 61. The thin film diodes, A, converts light to electrons, B, converts light to X-rays, C, converts X-ray to electrons, D, converts X-ray to light. All right, the correct answer is A, converts light to electrons. And if those last 3 or 4 questions confuse you, just keep rewatching it until you understand which one converts this to that. Question 62. This is another situational question. A tumor was found on the right breast in the lower inner quadrant. Which breast clock position is this considered? A, 1 o'clock, B, 5 o'clock, C, 7 o'clock, D, 9 o'clock. So I'm going to fill around with you all too. So you may have to use your hand to like fill around whenever you're taking your test. Okay, I have my answer. All right. The answer is B, 5 o'clock. And you can use this picture to kind of like help you guide it. Like, look where it say right breast, and then you find lower in the quadrant. And if you start from here, this would be 12. This would be 3. This would be about 4. This would be about 5. So this is still in the lower inner quadrant because 6 is right here. Then you have 9. So I hope that helps. Question 63. Another situational question. A tumor was found on the left breast in the upper outer quadrant. Which breast clock position is this considered? A, 1 o'clock, B, 5 o'clock, C, 7 o'clock, D, 9 o'clock. All right, the correct answer is A, 1 o'clock. So we'll take the left breast. This is left breast. Okay, this is 12 o'clock. And then this is about 1 o'clock. C is still in the upper outer quadrant. This is 3 o'clock. And then 4, 5, 6 is right here. 9 is right here. So that's the answer is 1 o'clock. Question 64. Another situational question, because you all have to understand this. A tumor was found on the left breast in the lower inner quadrant. Which breast clock position is this considered? A, 1 o'clock, B, 5 o'clock, C, 7 o'clock, D, 9 o'clock. All right, since I have my answer, let's see what it is. So the answer is 7 o'clock, and it's saying left inner quadrant. So left breast, left inner quadrant. So we have 12 o'clock, 3 o'clock, 6 o'clock. This is about 7 o'clock, maybe, because you have 8 o'clock about right here, and then 9 o'clock is right here. So 7 o'clock is still in the lower inner quadrant. All right. If you all do not understand that, if you check my playlist, I have a video where I go over it in more detail, or you can just keep rewatching this section. Question 65. How many breast lobes are in the female breast? A, 1 to 5 lobes, B, 5 to 10 lobes, C, 15 to 20 lobes, D, 20 to 25 lobes. All right, the correct answer is C, 15 to 20 lobes. Question 66. The term menarche is considered A, the first menstrual cycle, B, the first pregnancy, C, the last menstrual cycle, D, the last pregnancy. And this would be for early menarche. All right, the correct answer is A, the first menstrual cycle. Question 67. A woman that has given birth to at least 24 weeks is called A, menarche, B, nulliparity, C, parity, D, primiparity. All right, the correct answer is C, parity. Question 68. A woman that has never given birth is called A, menarche, B, nulliparity, C, parity, D, primiparity. All right, the correct answer is B, nulliparity. Question 69. Macromastia is the medical term for A, breast reduction, B, small breast, C, large breast, D, lumpectomy. All right, the correct answer is C, large breast. Question 70. The surgical removal of the entire breast is called A, breast reduction, B, excisional breast biopsy, C, lumpectomy, D, mastectomy. All right, the correct answer is D, mastectomy. All right, so let me know in the comment box when you are taking your registry exam. Question 71. This is a situational question. A 35-year-old female is high risk for breast cancer and has decided to remove her healthy breast tissue. Which surgical procedure will she have? A, lumpectomy, B, mastectomy, C, prophylactic mastectomy, D. Radical mastectomy. All right, the correct answer is C. Prophylactic mastectomy. This is whenever the patient does not have breast cancer, but since they are at high risk, they chooses to just have the mastectomy. So they're removing their healthy breast tissue just so they can prevent it from happening. Question 72. The removal of the lymph nodes, chest wall muscles, and the entire breast is called A. Lumpectomy, B. Modified radical mastectomy, C. Prophylactic mastectomy, D. Radical mastectomy. All right, the correct answer is D. Radical mastectomy. Question 73. The removal of the nipple areola region, the entire breast, and some of the underarm lymph nodes are called A. Lumpectomy, B. Modified radical mastectomy, C. Prophylactic mastectomy, D. Radical mastectomy. All right, the correct answer is B. Modified radical mastectomy. Question 74. Which surgical procedure involves using the muscle, fat, and skin from the abdomen area to create a new breast? A. Deep inferior epigastric perforator flap. B. Latissimus flap. C. Superficial inferior epigastric perforator flap. D. Tram flap or transverse rectus abdominis myocutaneous flap. All right, the correct answer is D. Tram flap. Question 75. Which surgical procedure involves using fat and skin from the abdomen with no muscle? A. Latissimus flap. B. Lumpectomy. C. Superficial inferior epigastric perforator flap. D. Transverse rectus abdominis myocutaneous flap or your tram flap. All right, the correct answer is C. Superficial inferior epigastric perforator flap. Question 76. Which surgical procedure involves using fat, skin, and muscle from the upper portion of the back as well as muscles from the thighs or buttocks? A. Deep inferior epigastric perforator flap. B. Latissimus flap. C. Superficial inferior epigastric perforator flap. D. Transverse rectus abdominis myocutaneous flap. All right, the correct answer is B. Latissimus flap. Question 77. A surgical procedure to remove a cancerous tumor from the breast along with the small margin of healthy tissue around it is called A. Latissimus flap, B. Lumpectomy, C. Mastectomy, D. Transverse rectus abdominis myocutaneous flap. All right, the correct answer is B. Lumpectomy. Question 78. A BIRAS score 6 would indicate A. Highly suggestive of malignancy, B. Non-biopsy proven malignancy, C. Probably benign finding, D. Suspicious abnormality. All right, the correct answer is B, known biopsy proven malignancy. Question 79. A BI-RADS score 4 will indicate A, highly suggestive of malignancy, B, known biopsy proven malignancy, C, probably benign finding, D, suspicious abnormality. All right, the correct answer is D, suspicious abnormality. Question 80. A BI-RADS score 2 will indicate A, benign non-cancerous finding, B, negative normal results, C, probably benign finding, D, suspicious abnormality. All right, the correct answer is A, benign non-cancerous finding. Are you all good with your BI-RADS score? Let me know in the comment box. Question 81. The minimum automatic compression should not be less than A, 5 pounds, B, 10 pounds, C, 15 pounds, D, 25 pounds. All right, the correct answer is D, 25 pounds. Question 82. The area where electrons strike the target is called A, anode, B, filtration, C, focal spot, D, rotor. All right, the correct answer is C, focal spot. Question 83. A common tube tip for the anode angle for a mammography machine is A, 3 degrees, B, 4 degrees, C, 5 degrees, D, 6 degrees. All right, the correct answer is D, 6 degrees. Question 84. Which of the following is used as the grid strip in mammography? A, aluminum, B, copper, C, lead, D, metal. All right, the correct answer is B, copper. Question 85. To magnify the breast, the object to image receptor distance OID should A, OID is decreased, B, OID is increased, C, OID remains the same, D, OID is reduced by 1/4. All right, the correct answer is B, OID is increased. Question 86, we're almost done. So if you all made this far, you're going to do well on your test because you have a lot of questions just to study from. Which of the following occurs when resolution is lost during magnification? A, apply more breast compression. B, increase the mass. C, use a large focal spot size. D, use a small focal spot size. And which of the following should occur when resolution is lost during magnification? All right, the correct answer is D. You want to use a small focal spot size so they can give a better resolution. Question 87. The collimation should not extend beyond the image receptor's edge by more than A, 1%, B, 2%, C, 3%, D, 4%. All right, the correct answer is B, 2%. Question 88. A box of cells that contains numeric values that is arranged in rows and columns is called A, pixel, B, matrix, C, spatial resolution, D, voxel. All right, the correct answer is B, matrix. Question 89. The ability to image two very small, closely spaced objects is called A, contrast resolution, B, matrix, C, pixel, D, spatial resolution. All right, the correct answer is D, spatial resolution. Question 90, 10 more to go. Brightness is controlled by A, breast compression, B, voxel, C, window level, D, window width. All right, the correct answer is C, window level. So the crazy way that I'm able to correlate brightness with window level is brightness, and this is how I correlate words and things together. Brightness have an E in it. Level, window level, the level has an E in it. So that's how I always just match those two together because window width, it doesn't have an E in it. So hopefully you can find your tips and tricks on how to like easily match something together. Question 91. Which quadrant is known as the tail of Spence? A, lower inner quadrant, B, lower outer quadrant, C, upper inner quadrant, D, upper outer quadrant. All right, the correct answer is D, upper outer quadrant. Question 92, situational question. A tumor was found on the left breast in the lower outer quadrant. Which breast clock position is this considered? A, 1 o'clock, B, 4 o'clock, C, 7 o'clock, D, 9 o'clock. So I'll do it with you all. Well, I don't want to confuse you. Okay, I have my answer. The correct answer is B, 4 o'clock. So we'll take the left breast, lower outer quadrant, it said. So this is 12 o'clock, 3 o'clock. This about right here would be 4 o'clock because this would be 5 o'clock. And then you have 6 o'clock right here. And then 9 o'clock. Question 93. The U.S. Mammography Quality Standards Act, or MQSA, was enacted on A, January 27, 1992, B, March 27, 1992, C, August 27, 1992, D, October 27, 1992. All right, the correct answer is D, October 27, 1992. Question 94. Which organization regulates the Mammography Quality Standards Act? A, American College of Radiology. B, Centers for Disease Control and Prevention, or your CDC. C, Health Insurance Portability and Accountability Act, that's your HIPAA. D, the Food and Drug Administration, which is your FDA. All right, the correct answer is D, the Food and Drug Administration, FDA. Question 95, we're almost there. We got five more. Believe it or not, I am like super stiff, so I'm probably about ready to be done like you all are. Question 95. Which organization has guidelines that does not recommend women aged 75 years and older to have a screening mammogram? A, American Cancer Society. B, American College of Obstetricians and Gynecologists. C, American College of Radiology. D, U.S. Preventive Services Task Force. All right, the correct answer is D, U.S. Preventive Services Task Force. Sorry, around this time I'm looking down at my phone because I have to go pick up my kids, so I'm just trying to stay on time. Question 96. Which organization recommends screening mammograms every 1 or 2 years between the ages of 40 and 49 years old? A, American Cancer Society. B, American College of Obstetricians and Gynecologists. C, American College of Radiology. D, U.S. Preventive Services Task Force. All right, the correct answer is B, American College of Obstetricians and Gynecologists. The American College of OB/GYN recommends screening mammograms every 1 or 2 years between the ages of 40 and 49 years and every year afterwards. So if I'm going too fast, you can always pause the video or rewind. I have to pick up my child from school, not right now, but in like 45 minutes. So I'm just trying to make sure that I am done with this video because it is going to take a long time to upload as well. Question 97. Which organization recommend mammograms every 2 years for women between age 50 to 74 years old? A, American Cancer Society. B, American College of Obstetricians and Gynecologists. C, American College of Radiology. D, U.S. Preventive Services Task Force. All right, the correct answer is D, U.S. Preventive Services Task Force. Question 98. Which organization does not recommend breast self-examinations and clinical breast examinations for any age? A, American Cancer Society. B, American College of Obstetricians and Gynecologists. C, American College of Radiology. D, U.S. Preventive Services Task Force. All right, the correct answer is D, U.S. Preventive Services Task Force. Question 99. Which organization does not recommend breast self-examination and clinical breast examination for women aged 55 years and older? A, American Cancer Society. B, American College of Obstetricians and Gynecologists. C, American College of Radiology. D, U.S. Preventive Services Task Force. All right, the correct answer is A, American Cancer Society. Ooh, last one. So if you all made it this far, especially if you watched all the way to the end of the video, please put a red emoji that has like the 100 to it, or put like type 100 to let me know that you made this far. Type it down in the comment box. Which organization recommends annual screening mammograms and clinical breast examination at age 40 to 44 years if they want to have it? A. American Cancer Society. B. American College of Obstetricians and Gynecologists. C. American College of Radiology. D. U.S. Preventive Services Task Force. Sorry for stumbling, but I've been recording for almost an hour and 30 minutes, and I also had to edit the video, so kind of tired right now. All right, the correct answer is A. American Cancer Society. All right, so I have some questions for you. Please leave your answers down in the comment box for me. Did you find these videos or these questions and answers helpful to you? What other questions or videos would you like to see from me? Whatever you may request, I probably already have it in my playlist. Click it at the end of the video because I've made so many videos for Mammo. So I probably already have a video for you all made, but if I don't, let me know in the comment box. Also, comment down below your test date. How long are you going to prepare for your registry? I also have a video in my playlist. You have to just click on Mammography Registry Review playlist if you're going from the YouTube main page, or just click on the link that I'm about to put in the next slide. I have a video where I show you how to get organized, how to get prepared for your mammo registry, so I think you all should check that one out. But other than that, that's it for this video. Thank you all so much for watching. Please give the video a thumbs up. Like I said, I'm not getting paid to make this video. I just sat down the day before for probably, I don't know, 8 hours and worked on this video for y'all. These test questions are my own questions. You won't find them nowhere in a book or anywhere because I made these questions by myself. That's why it took about 8 hours, because I also had to record this video for an hour and a half, minus the edits and the repeats that I had to do. Also, I have to upload it. So anyway, if you do not mind, could you please just give the video a thumbs up? It took a lot of hard work for me to get this video like made and uploaded. And then I'm kind of like under the weather right now. You know, the season is changing to fall. I don't know if that has anything to do with it. So I would greatly appreciate it. These ladies right here on this page, they was the first two people who commented on my video letting me know that they passed their registry. So one of them passed their registry in May of 2025. The other one passed their registry in June of 2025. So these are the first two ladies. Shout out to them. Congratulations to them. They was the first two that came back to the video and let me know that more people start coming. But anyway, if you're not subscribed already, please hit the subscribe button so that you can find all of my videos and do not miss any new videos from me. Other than that, good luck on your registry exam. Be sure to leave a comment. Let me know how you all enjoyed the video. I know it may be long, but I feel like it is like a real kind of like mock exam for you to like study and prepare for it. So anyway, I hope you all do well on your test. Come back and let me know. Thank you all so much for watching, and I look forward to seeing you all in the next video. Bye.